hard to see, so everyone will have a chance to look at it. I'm just going to try and explain it as best I can until you're able to get close enough to see it. There's a preheat button, which I turned on before, and we're at about 109, so I'll give it a minute and it'll get up to 110. You want to be between 110 and 125. Okay. The knob to your left is going to adjust the airflow, okay? Now, as you can see in here, this is where all the particles are. There's kind of a fan inside that's going to blow air so that the particles are swirling all about the box, right? This adjusts how fast or slow that those particles are flowing. So obviously if it's slower, there's less friction. Faster, there's more friction, okay? There's a default, as Rosemary said, of about 50 for the speed. So we're just going to leave it at where it's at now and just keep it at 50, okay? The knob to your right is the temperature, and you want to be between 110 and 125. I have it set at about 110. I'll put up a little bit. But you want to keep track of what that is telling you it's at. So if it gets too hot, you want to turn it back down, okay? And the way to do that is with this knob. See, it's at 109 right now. If it goes up too high, past 120, you want to turn it down. Usually we're right in between here and here, okay? Now, before you turn it on, this is the place where you can put your hand in to assist the patient in stretching and doing range of motion exercises. And it's tightly Velcroed, but when the air starts flowing, some of these particles do get out, okay? So you want to make sure that you cover it up with a pillow before you turn it on, okay? And then your patient, let's say we're doing the right arm, you want to have them seated here comfortably. Maybe you'll use a pillow or two pillows to get their arm in a nice position where they're not, contorted, okay? And then this is the second entry. This is where the patient puts their hand. Sometimes it gets a little sticky. So you want to have them first wash their hands, and then
no jewelry.
No jewelry. I'll have somebody volunteer. And then they're going to be putting their hand inside. You're going to Velcro it securely so there's no air coming out. And then you can go ahead and turn on the machine. Okay? Does someone want to volunteer? Sure.
Wash your hands, Caesar.
Or sanitizer's fine too.
Okay.
You got your timer here. If you're working with your patient, you can just set the timer, put it to the side so that you have an understanding of how much time you're using. Or keep your eye on the clock. But if you're going to walk away and not do any exercises with that person you're stretching and just had them in there for desensitization for 20-30 minutes, then you would set a timer. Check on them after 5, reset the timer, and you can walk away. If you give them a bell, if they need help or something, so call you over, okay? So I'm going to go ahead and, well, it's up. Yeah, let's go. Grab a little. Right. Okay. Great. Yeah, that's fine. So you're going to do your normal assessments like you would in any other modality. Check the skin, make sure everything's okay. No abnormal issues going on, okay? And then you're going to have them place their hand in here. Give them a pillow for a little bit of elevation. Let's see how far you are in there. A little bit closer, I think. So you can kind of see, once you have a chance to look over here, his hands are inside. Okay.
So we got the wrist
inside?
Yeah, it's got the wrist inside. Depends on what you're working on. If there's desensitization farther up, then you want them farther in. Okay. But for right now, we'll just. How's it feel?
Nice and warm.
Nice and warm. It's actually pretty soft for a corn husk. Okay. All right. So I'm going to turn this on. I'm going to cover this up until I turn it on. Okay. So your start treatment button is down here. I can't see sideways here. Okay, so that's the fan blowing. There's a stop treatment button that you're going to turn off when your treatment's over with, okay? When the timer goes off, you'll turn it off yourself manually. There is a way to program it, but we're not going to mess with that, okay? Okay, so as you can see, it really does have a lot of movement. It's surrounding his hand. You probably can't see that very well, but how does that feel?
Very good, very relaxing, like waves,
Soft and
random waves,
warm.
massaging all over.
Now, if you decide that you're going to work with your patient, you want to get yourself secured in here before you turn it on, because otherwise you're going to have stuff flying all over the place, right? But as you can see, I can get in here and maybe bend his wrist forward, backward, side to side, do range of motion, resisted flexion, extension, ulnar deviation, radial deviation, if you want to do it that way. Or if it's just for desensitization, then they can be left alone and not, you don't have to put your hand in and work with them. Like Rosemary said, you can use it on lower extremities too. I think most of the time you'll see it being used on hands. So again, after 5 minutes, you want to check to make sure that they're doing okay and they can tolerate it pretty well. And then complete the rest of the treatment time. Okay. And then to stop treatment, there's a stop treatment button. Okay, and we'll just back up a little bit. There we go. Yeah, you're probably a little bit stuck on your butt. It shouldn't be too bad. So like we were talking about, it is a little messy, but not too bad. Just like dusting off though. Okay, and then you want to check the skin integrity. Ask them how they feel, if there's any difference. If you have to take range of motion measurements, you can do that afterwards as well to see if there's a difference in their range. Whatever it is that you'd be using it for. All right.